All right, earlier this week, HHS Secretary Robert F. Kennedy Jr., he held a Make America Healthy Again summit. It was in D.C., where he said the Trump administration has a generational opportunity to change the course of health in this nation forever. And things are already starting to change. Look at this new Gallup report. The obesity rate in our country, the USA, is actually falling down from a peak of nearly 40% in 2022. Last night, while in D.C., I got the chance to talk to Secretary Kennedy and the head of Medicare Medicaid Services, Dr. Mehmet Oz. Take a look. You like the dynamic duo. I watch you guys tag team. All right, tell me about the MAHA Summit. Then we'll get into the insurance question, which is now top of mind for a lot of people. We're just all talking about fitness. We're coming on the air. What was the summit?
MAHA Summit was a convocation here in Washington, D.C. There are 800 sort of high-end people and MAHA leaders, some of the moms, and also people from technology companies, people, influencers. We were just talking about Dana White and Gary Brecka were there, and Danica Patrick. There was also big, scaled companies like Walmart, the CEO of Walmart, CEO of Starbucks, and it's an invitation for business, technology, for all of these different groups that come together, medicine, try to make our country healthy again, to transform our country through a private-public partnership that includes innovators and entrepreneurs. And what we said, the point that we made again and again is that you can do well by doing good. Yeah. And that, we've got to, our country is in a death spiral. We pay 2 to 3 times what Europeans pay for health care. We pay almost as much as all the other countries in the world, and we have the worst health outcomes. And, with the highest diabetes rates, we've gone, when I was a kid, there was a typical pediatrician see 1 case of diabetes in his lifetime. Now it's 38% of teens. As you pointed out, the obesity rates, 150 million Americans have BMIs over 30. This is obese. And the autism rates, as President Trump often likes to point out, in 1970 were less than 1 in 10,000, so 0.7 in 10,000. And today, the latest number is 1 in every 12.5 boys in California, 1 in every 19 kids in California. And the other states are similar. And
if you had Gavin Newsom as your governor, you probably want to eat more, too. That'll cause you to gain weight and raise the risk of diabetes, or is that a false conclusion? I'm kidding. All right, let me ask this. Actually, Dr. Oz, I've got to give a lot of credit to him. You've played a role in making me healthier and think about health, wellness, nutrition, longevity. Jillian Michaels is another one. Yeah. Gary Brecka is a third one. Gary Brecka is a huge advocate of, for example, cold plunges. Those obesity rates almost guarantee the risk of heart disease, stroke go up, diabetes will go up. But people are now losing weight, and some people are using these obesity drugs, GLP-1s. Do they work?
Oh, they definitely work. And Secretary Kennedy and I had a big event at the Oval Office last week to satisfy a pledge the president has made to the American people, which is he's going to insist that we pay for the exact same medications, the exact price here as we do in Europe and in the affluent parts of Asia. And the reason that's so important is a lot of folks don't appreciate, you go to the drugstore 1 in 3 times, you can't pick up your meds because you can't afford them. And if those meds help you lose weight, you deal with all the downstream problems, the hypertension, diabetes, heart disease, kidney failure, strokes, dementia, all that stuff follows many times from obesity, which causes at least a quarter of all the healthcare expenses in the country. So at the Oval Office event, we delivered on the last of several different most favored nation drug proposals. So we've got the leading U.S. company, leading European company, all the fertility drugs are now less expensive. We're going to have a lot of Trump babies coming down the pike because folks can afford, 1 in 3 couples are under-babied. But the big problem, the big enchilada, pardon the pun, is all about obesity because it's such a massive problem for us. We cost twice as much as Europe, because we're twice as fat as Europe. And so by getting these medications at a price that is about 20% of the current list price, the price that these drugs actually sell for in Europe now is the same as here, we will, within 2 years of that ink drying in the Oval Office, start saving money for the American taxpayer. Let me say that because it's pretty important. We are paying money for these medications at such a low number that we will actually save money by driving down the incidence of disease caused by obesity. And that's just for the healthcare system. The value to America being healthy or being fit, being at your playing weight is immeasurable.
How many pounds overweight should you start considering a weight loss medication?
If your body mass index is over 30, that's a better way of measuring it rather than weight, because some people have more muscle mass.
BMI is kind of deceptive. Like, Bobby works out. He's got, a lot of muscle. Muscle weighs more than fat, right? So I would imagine your BMI is a little higher as a result, no?
Yeah, I actually don't know what my BMI is, but I think the BMI is over 27 are overweight, and then over 30 is classified as obese. And one of the things that, we like to remind people is the GLPs are really important arrow in our quiver, but they're not a panacea. They're not the only answer. President Trump wants us also to go back to the root causes of obesity and get people, they're better food. He's trying to reduce the price of meat dramatically in this country. He's taking all kinds of steps to do that. And then the Presidential Council on Physical Fitness is now being renewed, and to get people to engage in physical activity. And those are the best ways to lose weight, but some people are locked in a cycle of obesity and they cannot get out of it. And these drugs seem to have a really good effect on certain people in allowing them to reset their clock. And then a lot of the people either go off them completely, or they cut down their dose to half, and they can live much more productive lives and much less likely to get diabetes or heart disease or renal failure.
Appreciate you being here, Secretary Kennedy. Dr. Oz, always a pleasure, guys. Thank you very much.
Thank you, Sean.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.